So firstly, thank you for inviting me and welcome to Oxford Brookes University. This is a week of conferences. We had our annual conference of Oxford Institute for Sustainable Development last week, and actually David was speaking there. So it's great to kind of continue the collaboration as well. As you can imagine, the title was not given by me. An academic would never give you 2 words. He'd probably give you 20. So, building overheating is what I'm going to talk about. And I think it's really timely now because building pathology is all about identifying and managing risk. And building overheating is a big risk, probably the invisible risk that we don't foresee. It is a risk, especially for temperate climates such as the UK, because our building stock is simply not designed to withstand extreme heat. It's also a risk for people, and most importantly, it's a risk for health. This is a public health risk, probably that is a disaster that's waiting to happen. I have been researching this for many years now, and I think I'd like to share some of those kind of findings. I'll give a bit of background on what overheating is, try and define it and give you metrics. Interestingly, we don't have a consensus on overheating yet, what the definition is exactly. I'll take you through some research, then talk about some measures for tackling overheating. And I want to kind of suggest ways of integrating, assessing overheating risk through building pathology as well, because I think there's a very strong link now between the two. I do come from the field of building performance evaluation, and it's great to see Bill Border sitting just opposite me, learned a lot from him. And, we've kind of applied those approaches to building overheating as well. I want to end with some knowledge and data gaps because, you're here for a couple of days and it's worth kind of thinking about what are these gaps that we need to address. I run the Oxford Institute for Sustainable Development, and I'm leading the low carbon building research group. And one of the areas of work for several years, for the last kind of nearly 18 years now, has been on climate change adaptation. And what we try and do, focus on building overheating there. We measure and model the risk of overheating, currently and in the future, both for retrofitted existing buildings. We try and understand the factors that affect the overheating. So whether they are physical factors, human factors, or institutional factors. And apart from studying homes and offices, over the last kind of 8 years, I've been looking at care homes with colleagues in University College London and London School of Hygiene and Tropical Medicine. And recently, and even now, I'm seconded partially to Ministry of Justice to look at prisons. So again, a very hard to reach, difficult settings where the links between overheating and violence becomes very important. So this is as I said, it's a very key risk for buildings and for population groups. And they suggest strategies to kind of tackle overheating. Being an architect, I'm all for building related passive design first, not air conditioning at all, obviously. And now and in the future, and then look at policy recommendations and design guidelines. So we've had a body of work, and I'm saying that because some of you might be interested in it. There might be PhD students here, might want to go through some of the work that's happened. So we started a journey in 2009. We had an EPSRC project on climate change adaptation of suburban neighborhoods where most of the UK population tends to live. And we were looking at, how do you adapt those in Oxford, Bristol, Stockport. We use some of that knowledge. Some of you may be involved in the Innovate UK Design for Future Climate program, which I thought was very visionary because it meant a number of stakeholders coming together, thinking about these issues right at the design stage. So we are working with Bristol Ecotown, hospitals, schools, try and design them with climate resilience integrated. We started to look at empirical assessment of overheating across, social housing, for example, through building performance evaluation program. And then we got on to this care and extra care settings. Care sector is really important because most of the deaths that occur during a heat wave are amongst older people above 65 years, and most of them are based in care settings. So this is a very vulnerable sector that gets disproportionately affected by heat. We've also been looking at, what happens in retrofitted and existing dwellings, because sometimes, insulation without ventilation can lead to more problems than solutions. And then we have probably the largest care settings project working with UCL and LSHTM, where we have the national stock of care homes. So if any of you are designing care homes or interested in it, there is a building stock model now. And we kind of monitored 50 care homes just after COVID. And then currently I'm involved in overheating prisons, and then we're starting a new project looking at extra care settings, linking heat with health. That's the main kind of focus now. We also have potential good news about a very large grant, which unfortunately I can't announce because UKRI hasn't announced. But there will be a lot of work happening in this space now, especially linking these aspects. I want to touch upon why this matters, why building overheating has been put right at the front of the agenda of the conference. Because overheating, both in new and existing dwellings and buildings, is increasing even in temperate climates. I think there is a myth that in UK, which is a heating-dominated climate, summertime overheating doesn't matter. Actually, it does. In fact, in care settings, we are even observing wintertime overheating. And this is a major kind of issue. And of course, that has energy wastage and other, net zero kind of issues. Uh, Changing climate will make it much worse. We know that the extent, severity, and causes of overheating are being researched. This will become, as I said, with a warming climate, much worse. A number of reports from BASE, from ARUPs, are kind of accentuating and emphasizing this. And recent BASE report said that domestic stock will require 75 to 85% of cooling energy consumption if it is not adapted for overheating. When we had the summer 2022 heat wave in July, UK energy use rose by 5% during the peak period, which is quite alarming because if that continues, you can imagine we are in a very different state. A recent ARUP report said 9 out of 10 UK homes will overheat if there is a 2-degree warming, which is probably happening now. We're already 1.8. So this isn't the future. This is probably the present. We know smaller houses and flats are at greatest risk. And most importantly, overheating is a public health issue. This affects mortality, it affects morbidity, and the elderly and vulnerable population, the very young, the very old, those with underlying health conditions, pregnant ladies, those occupying captive environments are most affected. And there's a link between overheating and energy retrofits because, although we should do that for net zero and other reasons, this can sometimes accentuate the risk of overheating if not done properly. If there's not adequate ventilation, if you have single aspect with communal heating systems which are not well insulated, and of course, lack of shading is a big issue. Even homes nowadays are going up without any shading, whatsoever. And I mean external shading here. We know there's some work here, there's some guidance, primarily looking at new build, in building regulations, part O. And the Committee on Climate Change has very clearly said that there is little incentive still to retrofit adaptation measures to reduce overheating across the building stock. So hardly any retrofit projects ever look at climate resilience. I haven't seen. If you have, please let me know. It's very rare, and this needs to be kind of built into. Now, as we start on this large-scale transformation of our building stock, despite all this, we don't have a clear definition of overheating. There are a lot of metrics, but there's no consensus. It has come from the work of Fergus Nichol, who's kind of a leading light in comfort. So the absence of comfort or the presence of discomfort has been seen as overheating, using the thermal comfort field studies work. There are lots of other guidance now. You may be aware of SIPC Guide A, which talks about static criteria, offices, living rooms, they're above 28 degrees or bedrooms about 26 for a certain percentage of occupied hours are deemed to be overheated. There's more dynamic criteria because buildings perform as per outside temperature. So there are criteria based on TM52, which looks at the indoor threshold based on the running mean outdoor temperatures, and then is more forgiving, looks at hours of exceedance as well. SAP has still got a very basic criteria of overheating assessment. This passive house planning package, which looks at 25 degrees and 10% occupied hours, although that's also being reviewed now. And there's the housing health and safety rating system, which also has that 25 degrees threshold. From the UK Health Security Agency, 26 degrees is what is seen as a threshold. But again, that cannot be used for all vulnerable settings. In an environment where people are in rooms for 18 hours a day, or in settings where people are bed-bound, 26 might be too late. We might need something different. So at the moment, what tends to be widely used is this guidance called TM59, which is really saying that overheating is based on comfort in living rooms and bedrooms, so that sleep is not disrupted. So sleep has become a key indicator because bedrooms have been found to overheat quite a bit. And they have two slightly different criteria. Bedrooms are using the static criteria because it's related to sleeping, so you're not able to adapt that much. And what it's saying is that if 1% of annual occupied hours are above 26 degrees Celsius, they are deemed to be overheated. For living rooms, it tends to be more dynamic, where it's using the criteria of uh, the internal temperatures being determined by outdoor temperatures, using the running mean outdoor temperature. And if 3% of occupied hours between May and September exceed this threshold, then the space is deemed to be overheated. So essentially, it's putting in some adaptation measures that could be applied because you're in the living room and you're probably awake. But in the bedroom, it tends to be slightly more kind of static. So those are the ones that tend to be mostly used, you will find. Okay. I'll take you through the research that we've done on building overheating and try and kind of build a picture of what's happened. I'll start with Oxford because that's where we are. So we are somewhere probably, Headington is here. So we are, in this area. So we essentially, this isn't data produced by us. We took Earth observation data and we looked at land surface temperatures on a scale of 1 to 5, and the risk is highest at 5. And in Oxford, the risk tends to be between 3 and 5. In London, is much higher. So you can actually start to see that different population groups across different areas get affected. Oxford, I was told, or Oxfordshire has had 65 deaths, not this summer, but the summer 2022, when these were excess deaths due to the summer heat waves. We've also been predicting what happens in the future. So looking at North Oxford, the red shows that which homes will overheat, and as we go into 2030s. And this is using high emission scenario from UK CPO9, which is probably, much conservative. It's probably now, everything is getting overheated. So this is a current risk and is going to get worse in the future. We then looked at, what kind of buildings will overheat. And we know some of this already, southwest facing rooms without shading will definitely overheat. Homes with, higher density, exposed streets, darker pavements, having greater glazing area, presence of roof lights, lightweight homes, they will probably overheat more. We then kind of looked at homes which were retrofitted, which were new build, and also those that were existing, just to see what the difference was. And again, the same results that we were having from models were, coming through empirical data as well, that top floor flats were overheated at least twice to 4 times than others. Mid-terrace houses were found to overheat. And 90% of bedrooms that we monitored were overheated, which is why you see a lot of guidance related to nighttime temperatures and bedroom temperatures now. Insulated dwellings without adequate insulation had twice the chances of getting overheated. And I'll show you the kind of graph that's now published. So you can see the homes which are insulated, but no ventilation done properly have a higher chance. So I'm not saying don't insulate. I'm just saying what Peter Rickaby tells us, no insulation without ventilation. I think that's absolutely vital. Then we looked at some homes in Oxford recently. These were social housing dwellings over a longitudinal, so 2021 and 2022. And again, similar results came back. So this problem is probably growing and becoming much worse now. So southwest facing bedrooms are getting highest mean, highest min, highest maximum temperatures. And you can see the spread. It's over 30, 35 degrees sometimes inside homes. And that affects your health, well-being, productivity as well. I'll talk a little bit about a project that I've been involved in for quite a few years. This is called ClimaCare, which is looking at a building stock study of care settings. And as I said, older people get most affected. And we are working with health scientists to quantify the health risks of overheating. So not just kind of measuring temperatures inside rooms, but also taking core body temperatures and trying to relate how the room temperatures relate to core body temperatures for older people and for staff. We're also interested in working in environments that are hybrid. So you have office spaces, such as in a care setting, and also residential spaces. And how do you kind of deal with those differing needs of people? So we managed to kind of collect data from 50 care settings across the country. So this is probably the study. The data is now published in UK Data Archives, if somebody's interested. The impact of heat exposure on health of residents was then looked at by London School of Hygiene and Tropical Medicine. And some very interesting results have come. And then we produced the building stock model of the UK's, essentially the care setting stock. And you can see some of the bits that we found. So if you look at the graph there, I said 26 degrees is what is really taken as the guidance from UK Health Security Agency. And you can see how high the indoor temperatures have been in the summer. Nowhere near that. It crosses 30, 32. And almost all bedrooms overheat, and they overheat by a considerable margin over 26. They're often occupied during the day because you can have residents who are bedbound, and also throughout the night. So it's a very serious health issue that happens. There is hardly any cross relation done by the care staff between the underlying health conditions of occupants and relating that with overheating risk. And I think that definitely needs to be done. There's growing awareness now about extreme heat, but much more needs to happen in the building sector. Okay. We were fortunate that we were monitoring some of the care homes during the 2022 heat wave, where temperatures really went very high. And what I've done here is I've taken individual care homes and I've shown you before, during the heat wave, and after heat wave. The blue colored box plot, the blue colored bar is outside temperature, and the red color one is the indoor temperature. And what you notice here is, firstly, the indoor temperatures are very high. They are 35 degrees as well. But even after the heat wave, most of the time, the indoor temperatures are not falling down. So it tends to get hot and it stays hot because we are not able to get rid of the heat. And that's where I think building designers, building service engineers, techniques of building pathology come in, because we have to make sure that we get rid of that heat in some way. And this is not what's happening in these buildings. For a very long time, it stays like that. We looked at different ways of assessment. For those of you who do overheating assessments, there are various kinds. So we thought we'll apply everything that we know just to see and make sure this. So there are over 200 spaces being monitored across this project. And the red shows that, 2/3 of those overheat. If you use the static criteria, the dynamic criteria brings it down a little bit. But then if you use the TM59, which is what is widely used, about 75% of spaces overheat. So whichever criteria you look at, these are, overheating is prolonged, prevalent, and intense. And it needs to be tackled at the design stage, operation stage, and throughout the building life cycle. And this is becoming really important now. We also looked at what people thought about it, because that's quite important. In a care setting, you have care staff and you have residents. And we wanted to see what is their perception of overheating or heat generally. And some interesting results came by. So this is over 2,000 surveys. So these are, it's a large kind of sample of surveys. And we did over 2 summers. So not just, when it was very hot, because obviously everybody's going to say it's very hot. We also did 2023, which was more representative summer. And what we are finding is that there is a marked difference between what residents think about it and staff. And as you can see, staff are feeling quite hot. So if you look at all the 3 charts, you can see staff feeling much hotter than residents. They were less likely to find temperatures bearable and more likely to be cooler. Now, this is a problem because essentially the older residents are not sensitive to heat because of their own, metabolic rates, which means some external input is necessary to manage overheating, which is probably one of the reasons why deaths occur in care settings, because that threshold gets crossed within the core body temperatures without the older population realizing it. And hence the need for the health study that is also happening as part of this project. And what it's showing is that the designers and engineers need to be managing those different aspects of heat, where one group wants to be cooler, the other is fine. And actually they are not. And both of them need to be kind of managed differently. Okay, I'm now going to show some of the climate resilience measures, because, that's the problem. We know that this is a problem and this needs to be tackled. But I'm going to also talk a bit about, what has been shown. Again, the Arup report, which kind of modeled some of the housing archetypes. This is based on modeling results. And actually their findings are no different from what we've been writing about for many years, is reduce solar gain. So shading is important. There was a shading guide produced, I think, as well by Good Homes Alliance and Building Performance Network. And essentially that's more effective in flats than in houses. Solar reflectivity of walls and roofs needs to be looked at. Increasing openable areas of windows has greatest impact on nighttime ventilation. Obviously security, pollution, noise matters here. All those criteria need to be addressed. Ceiling fans were seen to be inexpensive, but again, we need to look at the floor to ceiling heights within flats, whether that's viable as a solution. Roof insulation was actually a good thing. Uh, but where there's no insulation, like roof insulation wasn't present in certain bedrooms, they were more prone to overheating. So essentially, it's showing that passive measures can do quite a bit, which is why I always say passive first in our climate resilience of, in adapting our building stock to overheating. We have to follow the passive first approach, and wherever we can, presence of cross ventilation, enhanced window opening, external shading, shallow plans, light colored surfaces, corridors that are adequately ventilated, along with, neighborhood level kind of strategies as well. Overheating cannot be tackled just at building level. It's not possible because you're getting a lot of gains from outside. So looking at green and blue infrastructure, nature-based solutions is absolutely vital, and looking at, high reflectivity surfaces as well and permeable pavings. So it is a building and neighborhood level, approach that we need to tackle overheating. But at the same time, we shouldn't forget occupants, because overheating is also affecting people and can be managed by people if enough awareness raising and education is there. So, when we are talking about shading systems, we need to make sure they're intuitive, they're accessible, and, they can be used by different population groups. Do we need to have windows at different levels? Older people may not be able to use certain kinds of windows, but others they could. In prisons where I, tend to work, you don't open the window that much. So how do you tackle? You can't put shading. Something that's just not possible. So you have to really go to the design, the drawing board for that. It's really important that we can have some area where people can get to, like shaded balconies or other, communal spaces where people can escape from heat. In the care sector, in other sectors, UK Health Security Agency suggests there is a space which is below 26 degrees, which people can get to. It's a great solution, but the problem is some people are bedbound, so you can't move them to a single room sometimes. So we need to look at adapting, those spaces as well. We also need guidance. I know Oxfordshire County Council has got now guidance on Beat the Heat, which are manuals on, managing heat in summer, staying cool in summer, as much as staying warm in the winter. And that's really important, because when the heat wave happened in 2022, I was asked to give advice on public media, and I was saying, close the window when it's hot. And it was just against what you would say. You're not going to open the window if it's hot outside. And that's not very counterintuitive to what we would say. And the other thing and this is going to come again in slide as I show, is temperature monitoring. I think is really important. We need to start to see those, smart systems now being used to our benefit. So how they can become alert systems. So we can alert people that, this is going to be a problem and how you can tackle it. Tracking overheating is important. Dynamic thermal simulation is what I would suggest, because that's more robust, but obviously not every practice, not every firm is going to do dynamic thermal simulation for every building. And I'm going to suggest an approach for that later on. But I think there's a role for building pathology here in terms of inspections and measurement. When you're doing your visits to inspect buildings for other kinds of failures, whether it's moisture related or others, I think it's worth building a checklist for overheating as well, because that's where I think we are lacking completely. And I think we need to build that capability across the sector so that, every building can really be inspected, because this is a, problem that will affect all of us. I'm going to suggest some ways of kind of incorporating this within the building pathology techniques. And let's see, I think what the kind of reaction is. So first, you may have come across this. Good Homes Alliance has developed a tool in collaboration with us on looking at existing buildings. And it's a very simple overheating checklist. It doesn't require modeling. So what we were saying is that every building needs to do this, because you can determine whether your building is low risk, medium risk, or high risk. And it tells you where you're located, whether there is enough green infrastructure around, what are the orientations of the facades. And then it gives you a quantification of that risk. It's freely available. I think it is. Yes, it is freely available because the university was involved, so it probably has to be. As a one-page risk assessment, which you can do at the early design stages. You can also apply actually for existing buildings, I think. And then where you start to get issues or the building is more vulnerable. So let's say you're dealing with a care setting or an extra care home or west-facing facade. Then you start to do detailed assessment of overheating risk for those buildings. I have to talk about the simplified method because that's what the government suggests, limiting solar gains and increasing ventilation. But I am going to say what I'm actually saying is use dynamic thermal simulation for those buildings which are high risk. So I'm not saying do that for all. Can I have a show of hands today? Anybody who does this, like dynamic thermal simulation? Okay, so that's 2, 3. Okay, so you can see the scale of the problem. So out of 3, I think we are 100 registered. So 3% are saying, approximately. So this is where we need to be. And I think there's a role for universities here where we need to provide that training as well in these software and in these techniques so that this can be widely used. Then I think, as I mentioned, indoor temperature monitoring is important. Previously when we were doing building performance evaluation studies, monitoring equipment used to be quite expensive, several hundred, sometimes thousands of pounds, but now it's much cheap. And although those low cost sensors may not be the most accurate, but they'll give you the trend. And I think it's important to utilize them to our benefit. At the moment, our heat health alert systems are based on outdoor temperatures. I know it sounds strange, but that's what it is. The Met Office uses outdoor temperatures across different areas to declare, if there's a heat alert. I think now it should, because buildings are seen as modifiers of heat, we need to look at indoor temperatures as well. So it may not, it may not be that hot outside, but indoors you might have 30 degrees, even if it's 18 degrees outside because of internal gains and other things that are happening on solar gains as well. So what I am suggesting is that we have an indoor temperature monitoring and alert system, especially starting from vulnerable settings. So we can alert both the residents and their carers, for example, and then when certain heat thresholds get passed, a warning is issued. So action can be taken quickly. And I think that will enable a lot of remedial work to happen before damage gets done. I think, and we are lacking there. And a lot of data does get collected now indoors, but we are not using it to create those alert systems. And we can even have next day forecast or even next week forecast. It may not be the most accurate, but it's better than what we are doing now, right? We are using outdoor temperatures, which is fine because that's the data we have, but we need to now move into indoor as well. And that relates to indoor air quality as well, where most of the regulation is outdoor air quality and very little on indoor air. And the same thing I'm arguing for indoor temperatures as well here. And last but not the least, I think the occupants, and probably this should be the starting point, is to give those user manuals for managing homes in summer. That's really important, raising public engagement, public awareness about it, about opening windows, using fans, turning off unnecessary equipment, and maybe, even cool rooms within the home. It might be that you can actually move downstairs, when it's very hot, upstairs. So those kind of manuals are absolutely important. And we may need to air condition certain buildings, which are very, very vulnerable, but maybe for a very short period of time when we need it. Most of this can be tackled through passive means. Okay, I'm going to, I think I'll probably be running out of time. I'm going to talk a bit about knowledge and data gaps and then open it for discussion because I think there's a lot of kind of discussion to be happening here. I believe that regulations and supporting guidance are definitely needed to ensure that all this large-scale retrofitting that we are talking about incorporates climate resilience. We can't have buildings being built today that will need to be retrofitted for overheating in the next 5-10 years. That doesn't make sense from any perspective. So we must make sure that new buildings definitely, but also our existing stock, whichever is going through retrofit, is having that guidance. And that is lacking at the moment. Committee on Climate Change has been shouting about it for many years. Integrating passive cooling provision, whether it's through shading or ventilation, is absolutely vital. I think what we also have is limited evidence on the impacts of these retrofit measures. Where buildings have had shading systems or have had, different kinds of overheating resilience measures, there is hardly any data, empirical data that I love, to show that those are having an impact and effect on the building, but also on the people and their health, well-being, productivity as well. So this is a major issue. As we start to work from home more, overheating affects us as well because you're at home and it could be very hot. Designers have to anticipate future climate conditions as well as changes that are occurring socially with people staying, daytime occupancy increasing, especially for new buildings that may last hopefully even 150 years or more. So they will be in a completely different climate. So we need to be mindful of that. Again, very, very few designers are doing this for future climate. If 3% people are looking at it, you can imagine how few are looking at this risk for buildings coming today. I also think we need to have a repository of number of buildings that have adapted to overheating. We have no idea, how many buildings in UK even are adapted and, they are resilient, ready or, ready for overheating. And we need that. We also need to understand what's the spending on passive cooling measures. Is there any? What is the cost benefit of doing that? In the care sector, we have to look at avoided or, lifetime years saved as a result of putting shading. And it's very difficult because in a care home, how could you demonstrate that? It's very difficult. But, working with health economic experts, I'm realizing how important that is for doing evaluations. But again, we don't have any knowledge of that at the moment. It'll be nice to hear if somebody has actually quantified that. Uh, and then finally, I would say, I am saying indoor temperature monitoring needs to be done. It's low cost, but I think there is still a lack. There is some gap there where we don't have a green monitoring protocol. People install things wherever they want in the way they want, which is also a problem. We don't have a method for interpreting those measurements in a consistent way. Being an academic, I like to see robustness, consistency, rigor. Uh, not kind of making it much detailed than it needs to be, but it needs to be consistent. And we need to establish, in a definitive way that the space is overheated or not. And again, I think that's where the role of building methodology again comes in, because establishing those techniques and those consistencies are vital so that everybody measures the problem in the same way so we can tackle it consistently. I'm going to end here. I think I'm done, and I'm happy to take questions. Thank you for your attention.